Secretary Duque, September 19, dineklara muli ang polio outbreak sa Pilipinas after 19 years. Ngayon, anong ibig sabihin ng polio outbreak?
Ang ibig sabihin ng polio outbreak, batay po sa policy ng World Health Organization for a country na hindi ho nagkaroon ng wild polio virus for the longest time. And in our case, since year 2000, na nadeklara tayong polio-free. Okay, yun ang status po natin. So, ang sabi nila, even just one polio case, poliomyelitis case.
It's an outbreak.
It's an outbreak.
Ayon.
Pangalawa, if there are 2 confirmed isolates of polio, and in this case, vaccine-derived polio virus, in 2 different locations. Okay? So, nangyari po sa atin yan. So, yan ang mga pamantayan para sabihin na meron outbreak.
If you don't get the polio vaccine and you get hit by polio, what are the possible effects?
95% of those who contract the polio virus will show no symptoms whatsoever. Yung 5%, 4% magpapakita ng simptomas. So, ang tanong, ano yung symptoms? Okay. Fever, headache, abdominal pain, loose bowel movement. Yung remaining 1% will develop paralysis. Okay? 0.4 of the
1%?
1% will develop permanent paralysis.
Diyos ko.
0.5 will develop some degree of reversible paralysis, thank God. And 0.1% will die during the acute phase.
Kaya siguro natatakot yung mga parents na magkaroon ng vaccination. Meron palang vaccine-derived polio outbreak. Ano yun?
Well, ang ibig sabihin po niyan, galing po doon sa bakuna. At ang ibig po sabihin niyan, kasi pinapatak yan. So, nilalamon natin yung drops ng polio, it's in the gut, as a bituka. So, inilalabas din po natin yan. We're shedding it.
Okay.
Kasi hindi natin ginagamit yung injection. Oo. Dahil actually, mas maganda naman ang epekto ng oral polio virus. Mas malakas ang kanyang yung effectivity, yung immunogenicity. That's the technical term, no? Pasensya na po. Okay, so yun ang ginagamit. Pero para ho mawala yung shedding na yan, kailangan mo 95% ang coverage para there's enough immunity to make sure that the shedding stops.
What does the coverage of 90% of the people have to do with the shedding stopping?
Well, number one, you achieve herd immunity. So yung transmission na bakuran.
Ayon. In
Even if
other
they're
words,
little, yes.
95% ang kailangan immunized para siguradong hindi magkakaroon ng transmission. Less than 95% ang immunized.
There's a chance. Pwede.
But in the Philippines, the number of immunized people is only 66%.
Relatively low.
Which means that there is a possibility of greater outbreak.
It could be. If we don't do what we have begun doing, we have been doing supplemental immunization activities since August 19.
75% ang immunization natin noong 2015. Bumaba hanggang 66% noong 2018. Bakit bumababa?
Ang vaccine confidence sa Pilipinas bumagsak because of the following reasons. Number one was the dengue controversy of 2018. And then second, yung demographics ng kababaihan nagbago din. Marami ng mga nanay nagtatrabaho. So, minsan pagka pinupuntahan, hindi nila nadadala sa mga health centers yung kanilang mga anak. Or kapag nagkaroon po tayo ng mga supplemental immunization activities, yung door-to-door, wala yung nanay. Or kung wala yung nanay dahil nagtatrabaho, may sakit yung bata, may lagnat. In which case, bawal magbigay ng bakuna kung may sakit ang bata. Pangatlo, yung mga caregivers ayaw naman magdesisyon na wala yung nanay. So ngayon, ang sinabi namin sa mga local government chief executives, magbukas kayo ng Saturday and Sunday. Mag-off na lang kayo during the weekday and then compensatory doon
Tama
sa
nga naman yun.
weekends. Yes, because that's the only time the mothers will be at home.
How long will it take to get the Philippines back on 95% immunization of polio?
Right now, NCR is, I think, 11% of our target for round 0.
Round 1, October 14 to October 27. Round 2,
November. I think last week of November. I just can't recall.
And round 3,
Baka
January.
po tayo.
Wala pa kayong vaccine for January. You're waiting for that.
Yes, ma'am.
But round 1 and round 2, meron na
Meron
kayo.
na po.
Tayo lang bang kaisa-isang bansa na polio outbreak after 19 years?
Hindi po, ma'am. Meron po tayong mga ibang bansa na kasama. Ang China, ang Papua New Guinea, ang Myanmar, at saka Indonesia.
When is a communicable disease considered an epidemic?
Well, the WHO policy on this is, if I recall, 3 cases should constitute an epidemic. Indicator lang siya, ma'am, na kung may isang may sakit, parang there's an equivalent 200 that's going around.
Ano ang epekto ng measles sa isang bata?
Yung pong magiging komplikasyon niyan, sakit sa pulmonya, sa baga. Ayan po ang madalas na ikinamamatay ng bata. So dapat wag natin hayaan dumating sa ganun pong sitwasyon. So dapat dali na po kaagad sa pinakamalapit na paggamutan para na sa ganun masuri kaagad.
The vaccine rate of the measles in 2018 was 67%. In other words, 1/3 of the children did not have a measles vaccine, and this was down from 79%.
I told you, ma'am, in 2018, the measles supplemental immunization activity covered only 40% of our total target, and the report on the ground was that parents were, cursing our health workers, no? And they were saying, ito na naman, dengue na naman yan, tuturok na naman kayo, makakamatay yan.
Kasi measles injection.
Yes, ma'am. Yes, ma'am. But even polio got affected because the overall impression, the collateral damage that it did made no distinction whether it is patak or injection. The perception was very general.
As far as the Department of Health is concerned, this is all under control already.
Yes, ma'am.